Hi, I'm Dr. Franz, and welcome to a segment of Ask Dr. Franz. Our subject today is hantavirus. So everybody now seems to have heard of hantavirus. It has been around for decades, actually longer than that. We've only kind of like discovered or known about it since the 93. Anyway, it is a virus that is transmitted by rodents. It is a virus of the Hantavirus genus, discovered in the Hantan River in Korea, and there are several species within the genus. Sin nombre, which causes hantavirus pulmonary syndrome, or HPS, primarily in North America, and the focus of this talk. The Andes species, primarily in South America, and the one that is currently active among the cruise ships. The Hantaan species, primarily in Asia, and causes hemorrhagic fever with renal syndrome. The Sol species, which causes HRFS globally. The Puumala, which is a milder form of HRFS in Europe. Human-to-human transmission is rare, pretty much not the way it's transmitted. It is transmitted by rats and mice and exposure to their poop, saliva, and urine, and especially the poop, breathing it in. It can cause fever, chills, headache, nausea, vomiting, diarrhea, dizziness, fatigue, muscle aches, acute respiratory distress syndrome, which is the serious complication of this. Incubation is up to 42 days. Now, these symptoms, they're the same as the flu, RSV, cold, COVID, SARS, and like many other viruses, enterovirus, rhinovirus, human metapneumovirus. What does this tell you? This tells you it's the same pattern. And we're going to get to that because patterns are more important than labels. It is diagnosed with a special blood test, like, everything else. There is no cure. It is a virus. And the Western treatment is only supportive, meaning fluids, oxygen, careful monitoring. The hantavirus pulmonary syndrome is serious, with a 35% mortality rate from HPS, but early identification and supportive care can greatly improve the chances of survival and recovery. Well, how about we just prevent it? Now, we talked about patterns, and this is what traditional Chinese medicine is about. All infections or infectious agents impair the body's Wei Qi, the protective defensive energy that acts as the body's first line of resistance against external pathogens. This is our immune system. Ancient Chinese physicians understood that disease prevention begins long before exposure. Well, hopefully, modern physicians of all nations understand this as well. The strength of the body's internal terrain, with proper sleep, digestion, energy, stress regulation, and immunity, often determines vulnerability. We only get sick when we're susceptible. And what makes us susceptible? A weakened immune system. What weakens the immune system? Poor sleep, poor digestion, stress, burning the candle at both ends, poverty, violence, abuse, pretty much common sense things. This basic principle is true across all disciplines. Traditional Chinese medicine sees patterns of illness. And as I've said, flu, RSV, COVID, hantavirus, measles, common cold, metapneumovirus, enterovirus, rhinovirus, coronavirus, not just COVID, all manifest with similar patterns of illness. So the herbs target these patterns in the immune system to prevent or treat if you have become infected. These illnesses or infections is obviously the end of that sentence. The best treatment is always prevention. Should you get sick, then please seek help ASAP. Our herbs can help treat it as well, our breathe again and croupy cough. Now, how do you prevent it? Common sense. Wash your hands and stay away from rodents and their waste. The best prevention is immunity. And it promotes oxygen absorption, regulates respiration, promotes digestive function, regulates the immune system, regulates the bowels, and eliminates toxins. It's easy. You take it the first 3 days or the same 3 days every month, twice a day, faithfully. It boosts the immune system and prevents illness. If you need to clean up rodent poop, in your garage or on your porch. Wear a mask, okay, and be in a well-ventilated area. Try, not like vacuuming or sweeping to stir up all the dust. Be cautious and stay hydrated. Hydration is so important, not just for this, for everything, okay? For everything. 50% of your body weight in ounces of water a day. The solution to pollution is dilution. And by staying hydrated, toxins don't get concentrated, the lungs can stay moist, and we can excrete things, and we can keep our immune system working well. So that is it for hantavirus. I hope this information has been helpful. And truthfully, it's just plain easy to stay healthy, to prevent things. Now, at the height of COVID, we've already had previous experience. All of our patients who were taking immunity for 6 months, 100% of them did not get COVID. At the height of COVID in 2021, 60% taking it regularly did not get COVID. The 40% who did had a milder course. Please invest in yourself and your family. Do something simple. Stay hydrated and take immunity every month and don't miss. It works. And the longer I'm in practice, the simpler I want things to be, the more affordable, the less worry, and I want you to be empowered and confident in the tools you have. So thanks, and I hope this answered your question. Have a great day.